On average, one person dies every 6 minutes due to a blood clot in the United States, according to the Centers for Disease Control and Prevention. Blood clotting disorders must be taken seriously to prevent cardiovascular disease or other medical emergencies. Enloe has an anticoagulation clinic where caregivers can make sure you have the appropriate level of coagulation. Hi everyone, I'm Daniela Contreras and I'm here with Yashoda Bhandari and Tina Solomon, nurse practitioners at the Anticoagulation Clinic located at the Enloe Outpatient Center, to talk about the importance of your blood health. So thank you so much, Yashoda and Tina, for being here today.
Thank you.
Thank you so much for having us.
So Yashoda, I'm going to start with you. Can you tell us what are blood clots and why do they happen?
Blood clots are gel-like blood collections. Normally, it happens to stop the undesirable bleeding. But when it happens in your arteries and veins, it can create serious conditions, and sometimes it can be fatal. For example, if the clot happens in arteries and it reduces the blood supply to the brain, it can cause a stroke. And when it happens in the arteries and it reduces the blood circulation to the heart, it can cause heart attack. And sometimes the blood clots happen in the big, larger veins, deeper veins, which we call deep vein thrombosis or DVT. And that can dislodge and can go to the lungs, which we call the pulmonary embolism. And if it is a large clot, it can be fatal sometime.
Wow, so it's very serious.
Yes.
So Tina, can you tell us what are the symptoms of blood clots?
Well, if it occurs in the extremities, such as the legs or arms, it's called a DVT. And usually those are painful swelling of the extremity. It can come on slowly or acutely, almost overnight. The other types might occur in the brain. And again, if the clot is in a certain place in the brain, you will see different effects. Generally, you might see slurring of speech, numbness of a particular side, or loss of movement of that area. In the heart, the blood clot can go either to the coronary arteries, and that's called a heart attack, with crushing chest pain, pain down the left arm, or in the jaw. And if it is in the atria or the upper level of the heart, that clot can be formed by an irregular heartbeat. If the clot does dislodge, it can go up and cause a stroke. But what we're trying to do is minimize that happening, so we do treatment for that. The other one that is most common is pulmonary embolism, and that's when a clot breaks loose and goes into the lungs. The patient can have shortness of breath, chest pain, or even have blood when they cough.
Oh, wow. Oh, wow. Is there a specific age where blood clots begin to happen, Tina?
It's more common in the elderly. I think it's because the blood vessels have become more rigid and clots are more likely to occur.
Oh, wow. Okay. And Yashoda, so how are usually blood clots diagnosed?
First of all, when patients have the symptoms, they go to the emergency department based on what they have, like a stroke symptoms, heart attack symptoms, and symptoms of pulmonary embolism, like she said, shortness of breath and things like that. There are so many tests. To test the blood clots in the extremity, they do called Doppler ultrasound. They look into the veins and they find out if there is a clot or anything. And if they want to look the clots in the lungs, they do a specific type of CT scan, which is called CTPA. And then some people are not eligible. They are not allowed to have dye, and they cannot have that CAT scan. In that case, they will have VQ scan to diagnose the blood clots in the lungs.
Oh, wow. Very multiple options.
Options.
So
yes.
Tina, how are blood clots treated?
Well, primarily they're treated with medication. If a patient is admitted to the emergency room, there may be a opportunity for them to actually go in, give a medication into the clot itself and break it up. Those are called clot busters or thrombolysis. primarily for most patients, they start an anticoagulant, such as warfarin, or it's called a DOAC, DOAC, which is the newer drug that is Eliquis or Xarelto.
Sometimes people are on anticoagulants or warfarin or other blood thinner not only because they have blood clots, but also to prevent the blood clots from happening. For example, if they have heart conditions like atrial fibrillation, they are on blood thinner so that they will not develop blood clots or prevent heart attack,
Right.
things like that.
What are some of the resources that you guys have here at the Anticoagulation Clinic?
Yeah. So as Tina says, blood clots can be treated in a different way, and there are so many variables, so many types of anticoagulants. And our clinic primarily see the patients who are on warfarin. So it is one of the anticoagulants, and that anticoagulants need to be monitored very closely, and we need to dose differently in different individual, because this medicine is not like fixed dose like other anticoagulants. That means our clinic provide comprehensive educations of warfarin and then manage their warfarin in an individualized way, because the dose is based on individual patients' behavior and their medications and their change around the life. So we keep monitoring around that specific scenario.
And is this the anticoagulation clinic treatments covered by health insurance?
Yes, we cover almost all health insurance and Medicare patients.
Perfect. So Yashoda, how can people access the services you guys have here at the clinic?
Usually what happens is they are diagnosed with blood clots or they are prone to blood clots and they are found out by their physician, either cardiologist or primary care physician or hematologist or pulmonologist. And they need to make a referral to our clinic. And after we accept that referral, we review everything and then and we'll handle from there.
So Tina, can you tell us what are some of the things that people can do at home to prevent blood clots? Are there any lifestyle changes that they can take to prevent them?
Yes, definitely. Stay active and moving. Eat a healthy diet. Stop smoking. And lose weight or consider looking at your weight, because that is a big factor, as well as other things such as your medical conditions. Hypertension and diabetes can make you more prone. Have regular cancer screenings. Cancer also can cause blood clots. If you're traveling, make sure that you're moving your legs. For instance, if you're on an airplane, consider wearing compression stockings and doing exercises with your feet while you're sitting on the plane. It can make all the difference in the world.
Oh wow, that's so interesting. Just fidgeting or something.
Mm-hmm.
Oh, very nice. Well, is there anything else that either of you would like to add that I didn't ask you?
Yes. When we were talking about patients that were more, or people that were more prone to clots, I'd like to mention that not only is it older people, but they're people who are sedentary or have a slow lifestyle. Those people who are in the hospital, in the ICUs or trauma units, who are laying in bed for long periods of time. Now they have special air compression units that prevent blood clots for them. Pregnancy is another thing that can cause or make you more prone to blood clots, as well as cancer. That's why I mentioned the cancer screening. They are also prone. Sometimes there are certain medications that make patients more prone to a blood clot. The doctors usually know about that, but that may be a reason why you come to our clinic. And I think that all of that is just a healthy lifestyle. Keep yourself busy.
Well, that's great information. Thank you so much, both of you, for being here today.
Thank you
so much for this opportunity.
And thank you all for watching. If you'd like to learn more about our anticoagulation clinic, head to our website, enloe.org/bloodclots. And if you'd like to listen to more Health Matters conversations, go to enloe.org/podcasts. We'll see you next time on Health Matters.